Senator Roberts.
Thank you, Chair. Thank you all for appearing tonight. Dr Manderson, the last 2 times I've requested your attendance at Senate estimates, you've been otherwise engaged. Does your role at CASA have your full attention?
Senator, can I just intervene briefly on that question? The first time I think that Dr Manderson was travelling overseas for CASA work, and the second time we only got notice, I think, 24 hours before the actual estimates hearing. So I think to suggest that Dr Manderson wasn't available and didn't have
That's true, so wipe that. But does your role at CASA have your full attention?
Yes, it does.
How many hours per week do you complete work specifically in relation to your role as Principal Medical Officer at CASA?
I don't keep a logbook. I would say it's in excess of 40 to 50 hours per week.
Are you full-time with CASA?
Yes.
What other roles and positions do you hold on boards or businesses?
Any roles that I have all been listed and notified to CASA on my required reporting.
Do you have any personal businesses, clinics?
Senator, we went through this a couple of hearings ago.
I want to hear from Dr Manderson.
But Senator, there's nothing further that we would add to what we told you previously. And from my perspective, Dr Manderson has done the same thing as all CASA staff do, which is she's provided advice on any potential conflicts of interest, mitigation arrangements have been agreed, and to my
Ms Spence, the senators asked questions. I have a question of Dr Manderson. I want her to answer.
Well, Senator, as I said, I'm happy to turn to Dr Manderson, but I do feel
Thank you.
that there has been advice provided to this committee previously.
Thank you. Dr Manderson?
Could you please repeat the question?
What other roles and positions do you hold on boards or businesses?
So I have declared on my declarations that I have a role on the Australasian Society of Aerospace Medicine Board. I have a role on the Australasian College of Aerospace Medicine Board. Both of those have been declared to CASA, and also, of course, my role at CASA is declared to those boards, and the potential for conflicts are managed appropriately there.
Do you have any clinics that you operate?
I have businesses that support doctors in their practices, but
Could you tell me more about them, please?
Sure. So the structure...
And are they declared?
Yes, they're declared. The structure of the way many general practice services work in Australia is that there is a company that's set up that employs the nurses and the receptionists and pays for the electricity and pays for the internet connections. And the doctors that work in those clinics see their patients in those clinics, and they're supported by the nurses and the receptionists and the internet and the computers and whatnot. So I have a service company that provides nurses and receptionists so that other doctors can look after their patients.
Do you work in those clinics?
No.
Have you ever received benefits or payments directly or indirectly for the administration of COVID-19 vaccines or injections?
I was operating a GP respiratory clinic under the Commonwealth GP Respiratory Clinic program, and those clinics were funded by the government to deliver COVID vaccinations and to do assessment and testing for people who may have COVID.
So that was while you were doing your job at CASA?
Partly.
Partly. Could you tell me more? What do you mean by partly?
So I established the clinic in Sanctuary Point GP Respiratory Clinic in early 2020, and I started with CASA in July 2021, and the respiratory clinic was closed in September 2022.
Thank you. What is the definition of subclinical?
Subclinical is a term that's usually used to describe the fact that someone has the presence of an illness or a symptom or a syndrome that is not overtly obvious to them or to other people. So an example might be subclinical hypothyroidism, where we do a blood test and we find that your thyroid level is low, and that might be causing some non-specific or vague symptoms, but it's not really obvious to everybody. That would be subclinical hypothyroidism.
Thank you. That was excellent. We had evidence at the last estimates that the buck stops with CASA in regards to determining whether a pilot is fit to fly, aviation safety and medical certification that would support aviation safety, and no other department has responsibility within that remit. Do you accept that, Dr Manderson?
Only to suggest that the buck stops with the individual pilot to make their own self-assessment of their well-being each time they walk out to the aircraft, and we encourage them to do that every time.
So apart from that, you agree?
Yeah.
Can you confirm neither you or CASA have evaluated the aeromedical implications of the pilots taking the new mRNA technology injections at low atmospheric conditions?
No, we haven't.
Sorry?
Senator,
No, we haven't.
Okay, thank you. Do you consider that you have any additional responsibility to evaluate in an aeromedical context or at least surveil a new medical technology that only has provisional approval?
No, that's not the responsibility of the Safety Authority.
Okay. So you don't think you have any additional responsibility, yet you agree the buck stops with CASA for aeromedical safety?
If somebody is unwell enough that they can't fly and has a medication that means that they can't fly, then we would look at that. But we don't decide whether or not a medication is safe.
How does a drug make it to prohibited or restricted use for pilots?
Senator,
Dr. Manderson.
So we look at the work that is done by the authorities that are responsible for assessing medication safety and approvals in Australia, and we have a look at all the literature and the evidence that's available based on the assessments by those expert authorities to see whether or not there are any aeromedical implications for that. So, for example, a new antidepressant might change the way someone thinks or feels or might be sedating, and so we would look at the degree of sedation that that antidepressant has been shown to have and decide whether or not a person ought to fly or not fly while taking that antidepressant.
Thank you. So who completed this evaluation for the COVID-19 products? Injections specifically. Dr. Manderson.
AvMed looks at all medications that are available to pilots to see whether or not they're a concern, and so they were assessed by the aviation medicine section in the same way we assess any medication that's available to pilots and air traffic controllers.
The answer we've been given before is that we relied on the experts who weren't named.
Senator, I think what Dr. Manderson is saying is that we don't do the actual assessment of the medication, but knowing what we know about the medication, we assess whether it will have a negative impact on a pilot. So we do not go into the detail.
Okay, let's continue then. Committee, I want to respect the committee's time. I've got a few questions to go through. In answer SQ 23-003972, CASA states it has no role in the Black Triangle medicine scheme. The TGA says the Black Triangle means that the medicine is new or being used in a new way. We encourage people to report any adverse events for these new medicines to help us build a medicine safety profile over time. So that's the end of the quote. So CASA does have a responsibility to report any adverse events if it comes across them.
The Black Triangle is designed for the people who prescribe, dispense, administer or take medications, and that's not part of the role of the aviation medicine section at CASA.
In a February 2022 Zoom meeting with Virgin pilots, Dr. Manderson, you stated that the provisionally approved mRNA vaccines or injections can cause myocarditis and pericarditis, but that you'd rather pilots got these conditions from the vaccine rather than COVID, which you claim to be higher risk. What evidence do you have to substantiate that claim that the risk of myocarditis is higher from COVID infection?
So there's extensive medical literature and evidence.
Could you give me the references, please? Titles, authors, publications?
Not immediately, but
we can take that on notice, Senator.
Thank you.
Sorry, have you got any more? I'm not going to cut you off.
Just-
I might go around and come back if you've got more.
Just on this thread, I've just...
Okay,
got a
just on
couple
that
more.
thread,
Yeah.
then I'll go across to Senator McDonald.
Can I point you to a study entitled, quote, COVID-19 Associated Cardiac Pathology at the Post-Mortem Evaluation, a Collaborative Systematic Review. That's the title. Published in the Clinical Microbiology and Infection Journal, 23rd of March 2022, which concludes that there was no increased myocarditis as a result of COVID infection. Can you please take on notice to provide what evidence or studies you have that refute a systematic review like that?
sure.
Thank you. In relation to question on notice SQ 23-003393, does CASA still not capture information in your medical record system in a way that allows conditions like myocarditis, Guillain-Barré syndrome and other COVID adverse events to be accurately reported?
So we do capture that information in our medical record system. So we ask every pilot and air traffic controller that's applying for a medical certificate to tell us if they have any symptoms or signs or diagnosis of any of those conditions, and they can write that in. We also ask their doctor, their medical examiner, to write in any details about any of the diseases or diagnoses or symptoms that pilot or air traffic controller may have.
So there are no incidents. Well, how exactly do you know that? If you can't give me a report of how many cases of myocarditis or any other recognised side effect you've recorded for each year, how can you say that there have been no pilots with adverse events?
Senator, the way we answered that question to you when you asked the question was we said
I'm
that...
after Dr. Anderson.
No, the medical record system is my responsibility, Senator.
So my question is still to Dr. Anderson. She's overseeing the whole of CASA.
Sorry, Senator. My view would be that the most...
I didn't ask for your view, Ms. Spence. I asked for Dr. Mandison's view. I want to know...
But it's
if
not
she's
Dr.
aware of it.
Mandison's responsibility. It's Mr. Marcellia's responsibility, and he is trying to
She's
answer the
responsible
question that you asked, Senator.
She's responsible for CASA's safety and aeromedical.
Mr. Marcellia is responsible...
I want to know her relationship with that. I'm asking her if
That's
she knows.
That's a different question, Senator.
That's correct.
Senator,
Dr.
Mandison sets our medical policy. The medical record system does
How
not
exactly
capture...
do you know that, Dr. Mandison?
Because it does not capture the information about whether there was an adverse event, whether it was simply a suspicion of an adverse event.
It doesn't capture that.
It captures comments that may have been entered into
So is
a
it
clinical record.
capturing it or not?
It is not capturing it in the way that you're asking it, and that was what we provided to you on notice.
How does it capture it?
Free text comments which might refer to symptoms, they might refer to diagnoses, they might refer to a comment that a patient made. So it does not capture the information in the way you've asked, and that was the response that we gave you to your question last time.
Final question on this thread, Chair. Does CASA, Dr. Mandison, does CASA still maintain that no pilot has been grounded or had a medical restriction placed on them because of a COVID-19 vaccination injury?
Yes.
Thank you, Chair.
Thank you.